heal me. Lord, I believe that Jesus you heal. Oh, Lord, I believe that you heal me from my weakness. Lord, I believe that you heal.
Good evening, Ghana. Good evening, everyone. This is another day the Lord has given to us. My name is Isaac, and today we are here with our beautiful ladies, and we have a doctor, a midwife, and a neonatal nurse. In fact, very beautiful young ladies. Are they young or old? Anyway, so the Lord has given us this opportunity to talk about another important topic. In fact, a lot is going on, and we've been just putting aside certain things that we are not talking about, and it's killing our children. It's killing us. You know, the future is our children. So if you don't protect the children, it means we have no future. This is why our beautiful young ladies and the highly professional people, hey, is it good English? But we take it like that, are here in the studios to talk about prematurity. So prematurity, we are leaving not every child behind. Everyone is important. So prematurity, as the topic says. And we are live from Adum Faces Ghana Radio. My name is Isaac again, and in fact, my guests will mention their names, and that will be the best. In Chi, we say, "Chenim dahwa inya emon chain." And without wasting much time, let me introduce my guests. Starting from the right, you are welcome.
Thank you.
And please mention your name and then where you are coming from and your position.
All right. My name is Blims Gerald, a neonatal nurse at the Hope Exchange Medical Center.
Okay.
Okay, so I'm Dr. Teresa Marco. I'm a senior house officer at Hope Exchange Medical Center.
And I am Marion Osei Mensah, a midwife at Hope Exchange, working in the NICU.
Well, so you are all welcome. Oxidation will take place and you get our health.
Yes, I believe you can.
Let's start calling our friends, our family members, our grandmothers, and our in-laws. We all play a major role in caring for these children.
Yes, I believe.
In fact, when one loses chance, when one loses focus, we might all lose focus. So everyone is not being left behind. We are all calling ourselves so that we can take care of these young ones. In fact, these tiny babies. And when you give birth to them, they are tiny. But I bet you, when you take good care of these children, they are more than more. They are the biggest. They are the fattest. And then they are the, what again? The hugest. In fact, and please, students, don't use that word though.
Heal me. Father, heal me. Lord, I believe that you heal me.
Without wasting much time, please let's spend some few seconds to share this on various platforms and then we'll be right back.
Heal me. Lord, I believe.
Log on to CCL Ghana Radio. Log on to CCL Ghana Radio.
Lord, I believe that you heal me. that you heal me from my weakness, Lord, I believe that you heal me. Heal me, heal me, Lord, I believe that you heal me. Father, heal me, Lord, heal me. Lord, I believe that you heal me. Heal me, Father, heal me. I have come under your throne. Heal me, Father, heal me. Lord, I believe that you heal me. Heal us, Father, heal us. Lord, we believe that you heal us. Heal us, heal us, Lord Jesus. Lord, we believe that you heal. Heal us, Lord. Heal us, Lord. We have come under your throne. Heal us, heal us.
You are welcome. And as we said earlier on, we are going to discuss prematurity. And my name is Isaac from Studios of Adumfie with my beautiful ladies and my producer here. We say special thanks to everyone who is spending their time, their energy, whatever they have, listening to us. And we believe you know more than we do, but you know, we say in Chi, we say even epokrana ya nsu togum. So we believe that knowledge never expires. So we are always here trying to gain more knowledge to in fact complement one that we have already. So you are all welcome again.
Thank you.
Thank you.
Please mature your voice a bit for me. You are welcome again.
Thank you.
So starting from my left, when we say we are talking about prematurity, and when we say prematurity, what is prematurity?
All right, thank you so much. When we talk about prematurity or a preterm baby, we're talking about a baby who was born or who is born.
Please speak direct to the microphone for me. Yeah.
So we are talking about a baby who was born or who is born before 37 completed weeks gestation, or the layman will say completed 9 months. So a baby who was born less than the 9 months is a preterm baby.
Less than 9 months.
Yes.
So if I give birth at 8.9, still,
You are still a preterm.
hey, just few days.
Yes, even
Oh.
a second.
Wow. And how can we distinguish between preterm and normal term? Because now you mentioned of some weeks, about you say 37 weeks or
Yeah.
9 months.
Yeah,
So it means that we have specific period for pregnancy.
yeah.
So can you help us with the difference between the preterm and the normal term baby?
So if you are born before the 37 completed weeks, you are a preterm.
Okay.
So between the 37 to 40 completed weeks, you are a term baby. If you exceed the 40 weeks completed weeks, it means you are going to be a post-term.
With the agency mwakokora sabe washu. Oh, okay. So with a preterm, Doc, I'm coming to you. With a preterm, what can we see to identify that this person is a preterm?
So for preterm babies, they usually
Please get close to the microphone
So for the preterm babies, they are usually small, very small babies, very tiny kids. And then also we may see features like they have a very thin skin.
Okay.
For 10 babies, see that okay, their skin is thick. But for preterm babies, they have very thin skin. Sometimes you may even see distended veins on their abdomen because of the thin sheet of skin they have. And then also they may have small genital organs, not not really developed genital organs. Okay. Yeah. So for the females, you see that their clitoris is very enlarged or prominent. For 10 babies, you see that their labia majora is bigger and is covering the clitoris. But for preterms, you see that their clitoris is prominent. Okay. And then also for the
before you go to, let me clarify something here. The labia majora, I think we are talking about the vulva, right?
yes, please.
So in that way we may get to know better.
Yeah, and for the males too, they may have undescended testes. So you palpate their scrotum and you see that the scrotum is empty. You can't palpate any testes, and the penis will also be very small.
Oh, okay. And with the palpation, is it done by a healthcare professional? Anyone can do it?
Oh, it's done by healthcare professionals.
Any healthcare professional, specific healthcare professionals?
Oh, I think for midwives, if you come to the hospital, usually it's midwives or the neonatal nurses, or people who work at the NICU who palpate and they will tell you that's okay. There's no testes.
For me, if I've been working at, let's say, I had knowledge about children, maybe I'm a community nurse elsewhere, and someone, I've seen that there is a child that we assume is a preterm, and I want to see the feature is preterm. Can I do it there, or still I need someone at the field to do it? Because once I'm a community health nurse, I think I'm a nurse or a healthcare professional. So is it always that we should seek for those who work with them or any other healthcare professional?
I think for community nurses, once you identify that this child may have undescended testes, fine. Because you're in the community with the woman, you can wash your hands thoroughly, palpate the baby. When you realize that there's no testes in the scrotum, then you refer the person to the health facility for us to also assess the baby.
Okay, that's nice. So on my right, Sister Evelyn, right? Yes, I'm right. So with the preterms, do we have types, or every preterm is preterm?
We have types. We have extreme preterms. Those who are born between 28 weeks.
Please, with the microphone, get closer a bit.
Okay. 28 weeks to 32 weeks. Those are the extreme preterms. Then we have the very preterms from 32 weeks to 34 weeks. Then we have the late preterm from 34 to 36 weeks. So those are the types that we have.
Oh, okay.
So depending on the type that you are and the challenges that you also face.
Okay, now what about that? So that one is the gestational age, right?
Yes.
Hey, wait a minute. So that is the gestational age. So what about the one that we use the weight to determine?
Usually we don't use the weight because the weight would rather be an add-on for you. Some people are born 30 weeks, that's very preterm, but they have 2.5 kg,
which is normal.
Just like a normal 10 kg, that's an add-on for you.
Okay.
And we have an extreme preterm that will be 0.5 kg. Yes, so you also have your downside. Yes.
Oh, I asked this question because when you are defining, you mentioned, I think Doc mentioned something about the weight. So that's what I was trying to find. If we have, if you are classifying, you can also classify according to the weight, or we should only classify according to the gestational age.
Classify of gestational age. That's it.
Oh, okay. That's very good. Interesting. So, in fact, if you just join us, we are live from Adonfie, and we are discussing prematurity. And you can see prematurity in the olden days, because care was not taken and then attention was not drawn, a lot of our babies died just like that. And there are a lot of things still even now is going on. sometimes the husband will run away from the child. Sometimes the mother will put the child elsewhere, and the child will just die like that. And when you take good care of these children, they come back to life. That's why we have our important guest here discussing this prematurity, so that we can all take good care of these children, so that tomorrow you not say that, hey, I don't have any child. You had it, but you threw them away. Yes, so very important. And we are saying that you should call any other person to join, and once you're also learning to learn it well, so that tomorrow you can also educate another people about it, right? So
You heal me from my weakness.
so when we are done with it, or do you have anything to add up about where we are, about the definition, the signs and symptoms? By the signs, and then with the preterm, do we have symptoms? No. They are signs.
Mostly signs.
Yeah, so the signs that shows that this baby is a preterm. So if you don't know cry when the child is there, you should be able to identify that this is a preterm baby. So that one, I think we need to add more about it. So Doc, I'm still on you.
Yes, please. So for the preterms, you realize that their plantar creases are a lot.
That word, plantar creases. The folds.
Yeah, the folds under their feet
Oh, okay.
are a lot as
Okay.
compared to the term babies.
Okay. Comparing to, so me, I'll compare those ones to malnutrition. Oh, they are different.
No, yes, they are different.
Okay. Okay. So please, let's continue.
Yeah, and then also you realize that the preterm babies have wide sutures.
Okay.
Right? So they are the lines in between their heads. When you give birth to a baby, the head is not fully formed. Right? The bones are just cartilages, and we have lines in between. So you see that the preterm babies, their sutures are very wide as compared to the term babies. Yeah, and then also they have something called lanugo hair.
Okay.
These are very thin hair that you see on the skin of preterm babies. They are very common in preterm babies. Yeah. Then also,
Okay, so to add up to what she said, you have things like their cry. They have this weak or shrill cry. So whenever they cry, you wouldn't hear it like a normal baby. It becomes very thin.
Okay.
Their voice becomes very thin. So that is a feature of a preterm baby who cries. So whenever you hear that cry, you know that this is coming from a preterm baby. And also mostly they are very weak, and they have also poor activity. They don't really move and then fidget like those big term babies. They are very weak and all. And then even when you are feeding them, they have this poor ability to suckle or swallow.
Okay.
So all these features, whenever you see on a baby, you know that this baby was born a preterm or is a preterm.
What about the head to the body circumference?
So mostly their heads are bigger than their body. So when you see that, you know that, because mostly the head forms first before the body, and the time have not reached for the body to be equal to the head, so they come out with their head a little bigger than their body surface. Yes.
Okay. And then is there another sign like the tongue, the lips, or any with the veins? You mentioned that.
Yeah, they are prominent.
Yes. So that the one, some of them, they are transparent. You can even see. So the transparent skin, that one is also there. And what about the creamy? There are some creamy substances that are found on babies, sometimes like whitish, compared to the normal adults.
The Venice caseosa.
Hey,
So the Venice caseosa, what I know, it doesn't really define whether the baby is a preterm or not, because we have a lot of term babies who have a lot of those Venice. It's more like a shea butter on their skin. Yes. Some babies tend to have a lot, others tend to have little. So it differs from babies to babies. But then I don't really think we can use that one to differentiate between a term or a preterm.
And a preterm baby, you see.
Please, the microphone, get close.
All right. Preterm babies, term babies, you see that they are flexed when they come, they equal, but preterms, they
extend.
Yes, they extend their extremities.
Oh, okay. So please, if you haven't seen a preterm baby before, just imagine the signs that we are talking about, and then you can even draw a picture of a preterm baby. And it's very important, because once you get to know, and then when your husband, or no, your husband don't give birth like that. So when your wife give birth, and then even if the person does not go to the hospital and they give birth in the house, then you can identify this child is a preterm baby. Thereby, I need to rush quick to the hospital for them to take attention. Very important. That's why we are here discussing this. And I know someone who gave birth to a preterm child, and because the society was just saying, hey, this is water child in Shuba in quote, that's in P, and then they did something to this baby, and the baby went to join the ancestors. And with this big mistake that they made, they never conceive again. And God gave them this baby to take care of, in order to quench their thirst. But because they did not pay heed to what our doctors, midwives, and nurses are saying, now they are childless. And it can also happen to anyone. So please, it's very important that we pay attention to certain things like this whenever we are discussing. Very important. And if you just join us, we are live from Adunfie, and my name is Isaac. We are discussing prematurity in the studios with my sister Marion, Dr. Teresa, and neonatal nurse specialist Evelyn, my boss. Today they will beat me pay. Yes, once we've got to know the signs and symptoms. The signs and symptoms. The 6 symptoms. All right. So we may talk about the complications associated with these babies. But before then, what causes prematurity or preterm babies? For when it's not yet time. Starting from my right.
All right. So we can divide it into two. We have the maternal causes, that things that are from the mother that will cause her to deliver earlier than expected, and things that are from the baby that will let the baby come out before the time. So the maternal causes, some are example like hypertension or eclampsia. Yes, that's when the BP goes so high. So in these cases, it's a medical decision to end the pregnancy, because it's the placenta that's causing the high blood pressure.
And it can also cause organ damage later.
Organ damage, yes. So, and it even causes placenta insufficiency for the baby. So it's best to end this pregnancy to save the baby and the mother. So this baby, the pregnancy, it might not be 9 months as usual, but because of the health of the baby and the mother, we have to end this pregnancy. So that will be one cause. Infection, another cause is infection. If you have infection in pregnancy and it's not treated well, or you don't go, they've given you treatment and you don't follow through, this infection can cause you to have early labor, so that you end up delivering earlier than you expected. Yes. Malnutrition, that means as you are pregnant, you are not eating well.
Those who eat shiri.
You are not eating well, so this factor can also prone you to having a preterm labor. Yes.
And so infections, malnutrition, and then maternal diseases.
Yes.
Then
we can go to trauma. Yes. Maybe an accident happened, somebody beat the woman, anything that will cause trauma.
Husbands who beat wives
can cause this woman to go into labor. Then stress. You are pregnant and you are stressed, a lot of things. It activates a lot of hormones that can terminate your pregnancy before term. Then that's maternal side. Well, we have diabetes too. Diabetes, either in pregnancy or chronic diabetes. That one too can let you have your baby earlier than your time.
And that one is These are the maternal side.
Yes.
Okay. And before we come to the maternal, Doc, I'm on you. So with the maternal side, aside the trauma and these things that you're talking about, and then we mentioned something like stress. So what about environmental factors?
Okay. So environmental factors such as alcohol abuse or smoking can also lead to preterm delivery.
Okay.
And then also mainly drugs. Yeah. When people abuse drugs, cocaine and other drugs, narcotic drugs, that can also lead to preterm delivery. And even apart from the environmental issues, when the mother also has some abnormalities of the uterus, that can also lead to preterm delivery.
Like the one they say, the biconweight, something like that.
Yes. Can lead to preterm delivery.
And let me add one. The mother's age can also prone her to having a preterm. Either she's very old or too young. Can also prone her to having a preterm.
Very true.
So, can you help us with the age difference?
Okay, so 15 downward, 25 and below. If you are 25 and below, that it can prone you to having prematurity. And if you are 40 and above, it can prone you to having prematurity.
But I was thinking is you say, 15 years, I was just happy, but for 25.
No, 25.
Oh, okay.
And below. Yes.
Wow. Hey. And so with the age matters to only the mother, but the men, the age doesn't cause anything. Okay, then we are free.
And then also, I would like to add that for prematurity, studies have shown that mothers who have preterm babies, prior preterm babies, end up having subsequent preterm babies.
And there is another question before we. I'll come back to you. But there is a question I want to ask before I forget. Those who do abortion, maybe have experienced abortion or miscarriage. Please let me use the word miscarriage because these days we are polishing everything.
Yeah.
So miscarriage, and then this child, I wasn't able to get him or her. Is it likely that I'm going to experience the next pregnancy?
Okay.
The same miscarriage.
So it depends on the cause of the miscarriage. So if the miscarriage is due to uterine abnormalities, if you don't solve that problem, it will still persist and then you still get subsequent preterm deliveries. If you have cervical insufficiency, if you don't manage it during your subsequent pregnancy, you still have preterm delivery.
And what about this one, AB blood group, the blood group compatibility?
Yes.
Does it also cause preterm, or that one there is after your first child, maybe the next one is just a miscarriage and they may not carry up to the term that we can call a preterm?
Yes. So after the first pregnancy, the subsequent ones, because you have been sensitized already, the subsequent ones, if you are not careful, you get miscarriages.
All right.
And so for every miscarriage, you have to go to the hospital, and then for us to find the cause of the miscarriage. Once we find the cause and you're able to solve or manage that situation, you may be able to carry other pregnancies to term.
Okay. And please, Mariam will take because we mentioned of the maternal. So what about the other one? Physiological, right?
The
fetal cause. Okay.
Okay, before I go to the fetal cause, I would like to address one of the maternal, which is multiple pregnancies. So there are a lot of pregnancies when the mother carries more than one baby, which is a multiple pregnancy, so twins, triplets, or quadruplets. So there's a high probability that you may not be able to carry them to term because they are two.
Okay.
They are competing for space and all, so you might not be able to carry them to term. So a lot of multiple pregnancies are delivered pretermly.
Okay.
So the fetal causes we have.
Before you come to that one, there is a story that I heard that those who have been having a CS can also preempt someone to have a preterm baby. That one too. Is there any truth in this?
Cesarean section. Okay. I haven't really found any studies like that.
All right. Okay. Please, you can continue, Mario.
Okay. So another maybe since we had maternal infections, we can also have fetal infections Yes.
The child that we've not given birth to is having infection.
Yes. When a pregnant woman has infections which is left untreated or persists for a very long time, so it travels into the womb or the uterus, which can also affect the baby. You get it? Which can also affect the baby. So that will cause the fetal infections. And then the fetal infections can cause a lot of things. One is fetal distress. The baby might be in distress, or because the baby is sharing oxygen from the mother's placenta. If there is any form of infections or any kind of thing in the womb, the baby will fall into any form of distress, which can prone the mother to a preterm labor and then eventually a preterm delivery.
Okay, and then I heard something like in fact it's your term, so I am not familiar with them. So in case I get them wrong, please forgive me. We have placenta abruptio, placenta previa, and the rest. How would that? Can you help out with this one? Is that one related to the maternal or the fetal?
So it's maternal.
Okay.
Yeah, placenta abruptio and then placenta previa. So the placenta abruptio is when the mother is bleeding after 28 weeks or so. Yeah, after 28 weeks, if the mother is bleeding before delivery, so the mother is losing blood. But then for placenta previa, is the bleeding is coming from the child. So usually in placenta abruptio, you see that the mother will come in pain. The mother is having painful bleeding. But for previa, the mother will just be there and be fine, but then she'll see blood. There's no pain, there's nothing. For that one, the blood is coming from the child, the fetus. Yeah. So and it can also lead to
preterm labor. Oh, okay. Yeah, so if you just join us, we are live from Adonfie and we are discussing preterm, prematurity, the same as preterm, because they are friends. And if we talk about the definition, we define it giving birth before 37 weeks of gestation. And if we talk about the causes, we are on the causes rather, but we talk about some of the signs that you can see on a baby that you can, this baby is a preterm baby. And then those doing justice to this kind of topic is our doctor, Dr. Teresa, our neonatal nurse, Sister Evelyn, and our midwife, Sister Mario. But anyway, they make one please, is there any other cause that can lead to preterm aside the one that we talk about, or we can continue as it comes, then we push in?
Yes.
Okay. Then please, will you help us with the care, because before we go to the let's go to the complications in preterm babies before we come to the care, because once we get to know the complications and we know what we are preventing, I think we may take it serious in taking care of these babies. So, Doc, I'm on you. What are some of the complications related to preterm babies?
Okay. So, some of the complications related to preterm babies is neonatal jaundice.
Jaundice, yeah.
Jaundice, yeah. So, their livers are not fully developed.
Okay.
So, they can't really conjugate bilirubin.
Conjugate as in converting the bilirubin into the water state for it to be excreted by the kidneys.
Exactly. Yeah, so they end up getting jaundice.
Please speak into the microphone.
Okay. Yeah, so they are prone to getting jaundice. Yeah, so when you have a preterm baby, you have to really monitor the baby. You have to always watch if you see any yellowish discoloration in the eyes or in the skin. You just rush the baby to the hospital. Yeah, and then also some of the complications are respiratory issues. So they need help with breathing.
Okay.
Because their lungs are not fully developed.
All right.
So sometimes they may even need supplemental oxygen for us to give them supplemental oxygen via CPAP or direct oxygen. Yeah.
BiPAP.
Yes.
Okay.
Yes, please. And then also they usually get hypothermia.
As in low temperature?
Low temperatures.
Okay.
So because I said earlier that they have very thin skin, so they don't have enough fat. Usually because we are older, or let me say for 10 babies, the fat serves as insulator. Okay. So it prevents the water in the child from evaporating.
Losing heat.
Yes. So for preterms, because they have just small fat, they end up getting hypothermia. That's why we usually place them in incubators to keep them warm. And then also we encourage kangaroo mother care.
Like putting the child to yourself, skin to skin, so that your skin will produce more heat for them. Oh, okay. Our neonatal nurse, please continue with the complications. What are some of the other complications that may be affecting newborn babies, especially with the preterms?
They have feeding difficulties.
Okay.
They have problem with suckling.
Please get close to
they
the
have
microphone.
problem with suckling. And when you eat, you breathe and you eat. But because they are small and their muscles are small, it's difficult for them to coordinate this breathing and eating. So they have these difficulties. Yes, and they have a problem with sugar control. So they have hypoglycemia. Yes, and
I think mostly that is what they go through when we are nursing them. These are most of the complications that they develop because they are having immature organs. They were not to term, so mostly they are having immature organs. So the moment you're having any form of immature organ, you have a difficulty or deficiency at that end. So we've talked about their liver, we've talked about their lungs, which is causing their respiratory distress, and then they also have immature intestines, let me put it that way, that is making them difficult to digest food and all. So sometimes even after feeding them and then you don't burp them really well, they tend to aspirate on whatever breast milk or feed that they are being fed on.
What about infections?
Yes, I was about to mention that.
Okay, then mention it. And
so they are prone to having infections because their immune system is not really developed. So if you don't take care and you just keep touching them or you expose them to the normal environment, they may end up getting infection, and then the infection will kill them faster than any other thing. Okay. Yeah.
So lastly, I'll add one. I nearly forgot, but by God's grace, I've remembered. So they have also this problem of we call retinopathy of prematurity. It is when a premature baby or a baby gets, let me say, an infection in the eye.
Okay.
Because the blood vessels in their eyes were not fully formed, they get a lot of complications which might lead to long-term loss of vision and then all. So a preterm baby is at a risk of developing that retinopathy of prematurity, which is a complication they get in their eyes. So we make sure that whether the baby has a symptom or no symptom of any eye infection, we will screen them for that so that they don't get a loss of vision in the long term.
Do they have anything related to infertility when they grow? Because when we were talking at first, we said that some of them have undescended testes, and when it's not detected, I think it can also cause another issue. So with infertility, is it also a complication?
Yes, please. So that one is a late complication or long-term complication. So if you give birth to a preterm baby and then you don't bring the baby for assessments for us to know that the baby has undescended testes, the child grows and then the testes doesn't descend. So there are some babies, as they grow, the testes will descend by itself, but for some people too, it doesn't descend. So if you don't identify this early, and then the child grows to become a full adult, gets married, the person may not be able to conceive.
Wow.
Yeah.
They are question man.
Yes.
And okay, I'm listening.
These are some of the complications they have immediately, but they are also prone to long-term complications because of some of the care and intervention, and for the mere fact that their time was not due before they came. So because we give them a lot of oxygen, our sister mentioned retinopathy of the eye. Too much oxygen, if they have been on the oxygen for so long, that one also gives them this condition. And because sometimes their liver are not mature, they are not able to produce the red blood cells that we need, so they get anemia a lot, and we transfuse them, and we know the complications that comes with blood transfusion. And they have cognitive problems because their brains were not fully developed before they were born. So some of them grow up having cognitive issues. And
Okay.
if you have a preterm baby, don't compare that preterm baby's milestone to a
The
term
normal
baby.
term baby.
A term baby, maybe when it's 3 months will be able to sit down, but yours when it's 3 months, because that baby came earlier, might not be able to sit down.
Sit
So
down.
these are some of the long-term complications that they might have.
And then I also heard that those who has undescended testes, when it's being stayed in the pelvis for some time, it can cause cancer. Yes, and I don't know if that one too,
The percentage is very low.
but it causes.
It can.
Okay,
There's
it
a
can
chance,
cause. Okay, so we are not far from the truth. Okay, so we are to discuss how we are going to take care of these babies. This is a very important area because this is where the power lies. A lot of people run away from taking care of these babies. So we are here to discuss that one. So in fact, if you just join us, Krana, just sit down because this is very important too. And then we are not far from getting the fruits of the topic. We are feeding you, giving you all the nutrients, and we can also join us on all the social media platforms. And we are live from Adon Faces Ghana radio station, and then we are only on online. And we pray that one day we can also come in air. Special thanks to my producer, Mr. Andrews, and my guest here, as they are going to do justice to the care that we give to this our noble and then unforgettable babies. They are our special loves. So starting from our midwife, Mariam, as Obapa said, international midwife. So international midwife, please help us with the care that we can give to them, starting from, okay, let's do with the physiological or the physical aspect and the physiological aspect. That is, you know better than I do, so please help us with that.
All right. So we've talked about a lot of physical features that we see about them and then their complications. So because they are mostly hypothermic or they easily get cold,
Okay.
we have to make sure that they are always kept warm. So the keeping them warm starts from the hospital before we even take them home. So preterm babies receive this conventional care that's in the hospital, which is the use of incubators or radiant warmers to nurse them in order to keep them very warm. Because the moment they are hypothermic or they go low body temperature, their blood sugar also starts to drop and then causes a lot of complication. So in as much as we are using incubators to keep them warm or radiant warmers to keep them warm, we also have a similar or equally important method which we call the kangaroo mother care or the KMC.
Okay.
So the KMC is when a mother places the baby skin to skin, a naked baby skin to skin with the mother's bare chest.
A naked baby.
A naked baby.
Okay, with the mother being naked too,
The mother's chest being naked.
or they wear some blouse.
No.
Okay,
a
naked,
bare
naked.
chest.
Okay.
Yes, naked to naked.
Ah.
The baby can only be in a diaper and then a hair and a cap.
Okay.
So the baby can be placed on the mother's chest.
In
to-
between the
in between the breast.
The breast. Okay.
Yes. So placed in the mother's chest in between the breast, and then the baby will be wrapped, placed in such a way that the mother's chin will touch the baby's head.
Okay.
And then the mother can also see the baby's face in order to detect anything and then attend to the baby's needs. So this is an equally important method because the mother keeps the baby warm. And then I say it is important, more important than the incubator because it helps early initiation of breast milk. The
Okay.
incubator does not have breast. So it helps early initiation of breastfeeding, and then early feeding as well. It creates bonding between the mother and the baby because mostly when preterm babies are delivered, especially the first time mothers, some of them they are very much afraid of the babies because of their features. They see them not to be a normal baby, but
Okay.
we treat preterms as normal babies, special babies.
Okay.
So this KMC helps the mother to get bonded to the baby. So whenever we teach them this method, we advise them and encourage them to practice this at home. And then this causes or this helps the babies to also thrive very well. So in areas where there is absence of incubators or radiant warmers, this practice or method can be encouraged.
How long should the KMC supposed to be?
So our aim is that the baby should get a weight of 2.5
before you stop KMC.
Yes, before you stop KMC, because a baby can be born as low as 0.5, 1.0, and then less than 2.5.
Not today.
Not. So they are able to achieve the weight.
Okay.
If you are practicing the method very effectively, you are able to achieve the weight very fast. And then even when a baby is more than 2.5, as long as you can accommodate the baby in your chest and the baby is very comfortable, you can still continue with the method because it is very helpful.
One question before we go to our neonatal nurse is that is it all breasts that we can put them in? Because some of the breasts, if you don't take care, the time that you realize it has crushed them.
It's all breast because you are not putting the baby's head in between the breast. The baby's head should come above the breast so that the mother will be able to see the baby's face. So it doesn't matter the size, you can place the baby there.
Because some of them, if we see his sister, so all breasts.
Yes, all breast.
Please. Since you're saying all breast, please, but I mean, I'm begging you, some of them, you should put something so that there may be a space for the baby, because otherwise you crash this baby.
Oh, they won't crash.
Okay. So, also, I want to add that it's not just mothers who can do KMC.
That's
The
my
fathers,
question.
the fathers can also do KMC. Yeah. So, if the mother is not well, let's say you've delivered.
He's well, she's well, then
the
father can
should
still do
support,
it.
Yes.
So that
Yeah,
the
the
mother will
father-
sleep a bit.
Exactly.
All right. So as to our specialness, so
we have put the care into 4 categories.
Okay.
The thermoregulation that my sister said, that's
Okay.
making sure that they are kept warm. Then nutrition. So when they come, we put IV fluid. We encourage the mother to give breast milk, and we encourage every 2. So we are putting NG tubes. We are doing
you were saying something. How long the time between?
every 2 hours. So depending on the weight and the baby, we will determine how much feed the baby should take at every 2 hours.
Okay.
So as frequently as you can, you feed that baby every 2 hours with the amount of milk.
Including the nights.
Yes, every
So
2 hours.
the mother should sleep for 1 hour and wake up.
It's as Hope Exchange nurse, we are very caring. When you, the mother, you are tired, we are able to do this for you. Sometimes for the few days, you are not even the one feeding the baby.
Okay.
We, the nurses, are doing it for you, teaching you to get your confidence before you go on. Then we come to infection prevention,
Okay.
which is very key, as doctor has mentioned. So we are encouraging the mother to wash her hand before coming into contact with the baby. Then we are practicing KMC. KMC 1 introduce the mother's bacteria to the baby, which also serves as an immunity to the baby. And when baby is put in KMC's position, it's difficult for other people to be touching the baby. Let's say the baby is in the ward. Oh, the baby has put his hand to the baby, so infection prevention is there. So usually our pre-terms, we wear gloves before touching them, except the mothers and the fathers.
Yes, and then
Understand what we are doing. So before we even start the KMC for you, have you eaten? Because it takes hours.
Okay.
Have you eaten? Please go and take your bath and come, because you stay there for long. We make sure it is done. So far as you bath, that one should be enough.
And then imagine I'm a father who have traveled from, let's say, Accra, and also from my village to Kumasi, and I come to Hope Exchange. My wife is there with my preterm baby, and you ask me to go and bath.
So we can just use water to clean your chest for you, and you are good to go.
Because I'm much concerned about the infection prevention.
Yeah. The parents, we are not so keen about they being sterile. We want the health personnel to be sterile
because they go to best.
Yes.
Okay.
But the parents, we want their bacteria to come to the baby's body to serve as a protection for them. So if we clean your body, you bath, you are okay with it. Yes.
What about those with cold that a runny nose and the rest.
So if it's that bad, we'll not let you do it. But if it's a minimal one, you just wear a nose mask and you are able to do it. But if it's bad, we'll not let you do it.
Okay, so this is the second one because we talk about the thermal regulation and we talk about nutrition and infection
prevention,
and then the last one
the emotional feeding. We've talked about feeding.
Yes.
Then the emotional support.
And before we come to the emotional support with the feeding, so what about the one that we use the thin kind of milk that we do for the babies?
The formula feed.
Yes, the formula feed, because some they complain that the milk is not coming, and some too they are saying a whole lot. Because I met someone, the person said the breast is too small and she doesn't think the baby will get the nipple to suck, so she has to get something. So what about that one?
So pre-terms, our best bet is breast milk. Mother's breast milk. It's the last resort for us to go for a formula.
Okay.
Yes, because it doesn't do so well. Because we mentioned that their guts are not fully matured. So if they take breast milk, it helps colonize. It has enzymes and things that colonize their guts. So getting formula, which is a different antigens and things, colonizing their guts, no. So formula will be our last resort in caring for preterms. So breast milk is the goal. So when you come, we encourage you, we do things for you for your breast milk to flow, so that we start feeding your baby with a breast milk. Yes.
Okay, Doc, you wanted to add something?
Yeah. So
okay.
Giving preterms, because their gut is not fully developed, giving them formula can lead to something we call NEC, or necrotizing enterocolitis.
I don't know what you're saying.
Infection of the gut. Because their gut is not fully developed, they can't really digest the formula feeds very well.
Okay.
So even with the formula, there are times that a mother will deliver, the mother is not at the hospital, so the mother can't produce, or maybe the mother had cesarean section, had how do you call it, PPH. So they can't produce breast milk.
Postpartum hemorrhage.
Hemorrhage, yes.
Okay.
Thank you very much. Yeah. So with that one, sometimes you go for formula, but even with that, we have to prepare it in a special way. You don't just take the formula and prepare it your own way and give it to the child. We have a percentage, or let me say volume of water we add to the formula, so that the baby can be able to digest it very well. So don't stay at home and then just start giving formula. Come to the hospital, let us teach you how to prepare it very well, so that the child will not get any diarrhea or any infection.
Okay, before you continue, let me acknowledge some people. Some of the names I may not be able to mention all of them, but I'll mention few. Rose Mami Equia, Anadem, Nana Akwesi, Angelo, Sarah Akumasi, Samuel Treme, Oba Paifia, and then the rest, because time is just beating us, so we need to finish up. Let's come back to our so we talk about it. Let the last one. So our neonatal specialist finish up with us.
So emotional support. This first we want the mothers.
Please get close to the microphone.
The mothers to know that yes, you can do it, even though this baby comes so tiny, so small. We want you to give that emotional support to the baby first. We give it to you. Then when you come, we tell you that sing to your baby, talk to your baby as if the baby is still in the womb, and you talk. Touch your baby. Sometimes they feel that baby is too small, we cannot touch. No, don't let the baby just see the nurse's uniform going past them all the time. When you come, sometimes they are far away. Is that my child? No, we want you to come closer. Pray with the baby if you have to. And all this in one gives the emotional support and neurological development to the baby. Then the mothers and the fathers also need everybody, because taking care of preterm is not an easy work. So all the mothers need all the support that they can give them to be able to nurse these babies. Yes.
I remember when I was taking care of one baby, and in the night you have to stand and the child will forget that she's supposed to breathe. So you have to help the baby. Hey, madam, please wake up and breathe. So I can see. But with the emotional support, with the families and then the society, there are certain things that we've been saying which discourage those who give birth to preterm babies. So what are some of the things that we can do to birth? I know how giving birth. My wife has given birth to a baby. Someone have also given birth to a baby. And then there is 3 months time. This child is just turning over. My mine is lying down still. So in that case, I feel some way. Hey, what kind of baby that have I given birth to? What are some of the things that we can do to encourage these babies?
Okay, so I want to say that usually when they come to the hospital, we let them know.
Please get close to the microphone for
when
me.
they come to the hospital, we let them know that their milestones might be a bit delayed as compared to
the 10 babies.
10 babies.
Okay.
So don't compare your child to a 10 baby, right? So if you have a first child who is a 10 baby, don't compare your preterm to that child. Say, oh, this child, when the child was 6 months, the child could sit without support or something, and then this one is delaying and you'll be so worried. No, because the child was born before their time, their right time, the milestones will be a bit delayed. Okay, so don't compare your child to any other. And even amongst the preterms, don't compare your child to somebody else's preterm child. Yeah.
Okay, with my Madam Midwife, I think you want to say something.
Yes.
Adam.
So gone are the days when babies were born prematurely that they might lose their lives along the line.
Okay.
Nowadays we have preterm babies who are much grown into matured adults and all. What we want to tell our mothers is that they should take whatever education and then encouragements we give to them from the hospital to their house very seriously, and take their clinical reviews seriously. Here in Hope Exchange, we have what we call the KMC clinic.
Oh.
It's a regular checkup that we give to every preterm baby who has been discharged.
Okay.
It's a follow-up visit that we want to know how the baby is faring. We've talked about a lot of complications that they develop along the line in as much as they are born prematurely. So we have the neurological delays, we have the clinic to assess them, we have the physiotherapy clinic to assess their sitting up, their crawling, their head to body symmetrical and all. So if you are not able to take all these clinic reviews seriously, when the baby is delaying and then he needs a medical assistance, you wouldn't know. So you have to make sure that all these clinical reviews, you take them very serious for your baby to catch up with their age mates. As doctor said, you don't have to really compare, but then if you are taking all these clinical reviews seriously, you will see where the baby is falling short and then give the necessary assistance for your baby to also grow very well. Because as we have in this year's prematurity celebration, equitable care to every preterm and a newborn. Every baby, we treat every baby as a normal baby, and then equal care to all of them. We are leaving, yes, including you. We are leaving no preterm baby behind. If they are born preterm or term, everyone has to grow well. So you have to make sure that you take all those.
Everyone has a right to equal care, and then you have the right to live too.
Yes.
Mm-hmm. Okay, with the same care, with the psychosocial or psychological care that we give to babies, with the preterm babies, there are a lot of things that they may need compared to a term baby. For instance, they are easily you need to go to the hospital as soon as possible, or in short terms, rather than those term babies. And then with some of the things that they go through, sometimes they will ask you, come for this, can do this. So with the financial burden, and sometimes too, the parents have to also devote their time from work. And you use the money to take care of these babies. And I have to stop sometimes, work to take care of these babies. How are you helping these mothers?
Okay, so one thing in Hope Exchange is that there are some of the follow-up visits that are how should I say it? They are less costly or free. When we take the ROP, for instance, the retinopathy of prematurity screening, when we refer our babies to CAT, our babies are mostly referred to CAT because they are having the machines. It is a free screening. The mothers don't pay anything. All that you need is to get your transportation to that place for your baby to get screened. If the baby developed any form of eye condition, it will be treated. If the baby
and this
didn't,
time around, I think they've added a ear
to it.
Yes, so
Yes.
you need to even in 10 babies, you need to go for
For
ear
it-
assessment.
Yes. So with that, if we refer you for such a screening, don't think that it's costly, so you wouldn't take the baby there. It's very important. So that is what should I say the health system
It's
has
trying
done to do to help the mothers in terms of financial.
How Doc is smiling. I think he has something to add up.
And then also, I want to say that if you are feeding your child with breast milk is free. Like, it's
Okay.
coming from you.
Yeah.
Some parents, from the start, they want to do formula. And formula is costly.
And that one, I can see that is the Gen Zs. We the young ones who are not giving birth. You know, we need to do it. And there are some stories that when you give birth and you breastfeed, your breast will
Will
sag.
sag.
Madam, if you sag, it will
It
sag.
will sag.
Yeah.
Of course. Very
So
true.
breast milk is free. It's not costly. It's just coming from your body. So you
Okay.
don't have to spend money on breast milk. But then if you try to do formula, it is going to cost a lot. Because as the child grows, you're going to increase the amount of food you give to the child. So if you're
Okay.
doing formula from day one, as the child gets to 3 months, 4 months, 5 months, you can't buy it.
So you chop Gary.
Yeah. So I think if more people are doing breast milk, it will reduce the financial burden on the parents. Yeah. If they do more breast milk, it will reduce the financial burden.
And then Doc, I'm on you again. With with these babies, we talk about in the reduced immune system because of their organs and
Are
then the systems are
immature.
not that grown, that immature.
Yeah.
So they are prone to infections. So how best can we help these babies as we send them home to prevent themselves from getting the infections?
Okay.
And please, I'll come to you because you provide us with the stigmas that is in the house. So once finish, I'm coming to you.
So as I said earlier, you have to wash your hands thoroughly before you touch your baby.
Okay.
You have to wash your hands.
And sometimes you forget to, they finish taking the diapers and they've forgotten that they're supposed to wash their hands. And we are
Straight to breastfeeding.
yes. So,
So you have to be conscious of it, that every time you want to touch your baby, you have to wash your hands. When you change the diapers, you have to wash your hands. Okay. When you sneeze, let's say you cover your nose with your hand, and you have to wash your hands before you touch your baby.
and when you had a cold,
Yeah, when you have cold, yeah. So when you have cold, you have to treat your cold, and then you also have to wear a face mask so that you don't infect the child.
okay.
And then also with their when you express the breast milk, usually they keep it in feeding bottles. They have cups and all that. You have to wash it very well. Usually they put it in hot water, yeah, to sterilize it. Don't just use, so some of them they don't wash it well. Just use any soap, liquid soap, and then water, and then they wash it and put
Because
the
we
breast
are
milk in.
washing, we are doing this, we are cooking, so the time we just divided them.
Yeah.
That's sometimes he steps in their shoes.
Yeah, it's not easy. But
Yes.
then, if you take the risk of, oh, I'm busy or I have lots of things to do, your child will get an infection and that will lead to serious complications later.
Now, what about those who like taking, hey, baby, and
yeah.
then a lot of people visiting it? Because in this our society, when you give birth, someone come to you and you say, no, don't touch my baby, you'll be in trouble.
Yeah.
So that one,
So for that one, we have to encourage, like usually we tell them that you are the one who has given birth. So if someone wants to visit, the person should come and see you, not the baby.
and
Because we
would
don't
the
want them-
society agree to
They
this?
have to understand. Yeah, they have to understand that these children are prone to infections. So any little thing can just cause serious complications. So we usually advise the parents when they are going home. We really counsel them, even their grandmothers or their support systems.
Especially the ASIL people.
Yeah.
Yes. So we
Yeah.
encourage them that, or we educate them. Usually, even when they are not around, we tell them to call them to come to the hospital so that we educate all of them, we counsel all of them that these are the issues the child may have. So we are trying to prevent these issues. So don't be touching the baby. And if somebody wants to visit the newly, let me say the mother who has delivered, they should just see the mother and let the baby rest. They shouldn't.
We are welcoming the baby.
It's not easy because of our society,
Yeah.
because of our culture and how we do our things. But then for these babies, they are very special. We don't want to expose them to a lot of people, a lot of infections and all that. So they have to understand and bear with us. When the baby grows, you will see the baby.
Yeah, when they are big and fat,
Yeah,
they
when
should
are
come
big,
back.
you see
When
them.
they even comes, you can go to your mother.
Yes, exactly. Exactly.
And our neonatal specialist, now I'm on you. So with the stigmas that we find in our society, especially when someone give birth to a preterm, I remember there was a statement that someone made some time ago that a certain woman said, you young child, young man and young woman giving birth to this kind of baby, me that who is old could look at my baby. So with these things, it sometimes traumatize the caretakers or the parents. So what do you tell your patients in order to cope with the stress and then the stigmas in our society?
Okay, first I want to start that it's nobody's fault that you have given birth to a preterm.
Okay.
It's not because they say don't marry this man and you've gone to marry him. So now the reward is you having a preterm, or somebody have jujued you to have a preterm. No, there are scientific reasons why someone will have
A preterm,
and
okay.
it can happen to anybody. Anybody can have a preterm baby. Yes. So there's this stigma that when you give birth in the 8th month, when you are pregnant in the 8th month, the baby melts. So
Yes,
when
I've
they
heard
heard
that
that
one.
somebody has delivered in the 8th month, they say, hey, then this one day the baby will not survive. Oh, it's not a good baby. Oh. No, let's encourage that baby. We prefer an 8-month baby to a 7-month baby. So those baby, and we need to, if you are an in-law, your daughter-in-law has given birth to a preterm, they need all the support. They need all the help that they can get. You are a husband. Your wife has given birth to a preterm. This is not the time to desert her. She needs all the support and she needs all the help. You are an uncle and auntie, a family member. We all need to come together to help preterm, and preterms are doing great. They
Yes.
come out being intelligent. Somebody will say that, oh, this one when they will become disabled. No,
They are very strong.
they are very strong.
I can attest to this.
And if they don't tell you that this is a preterm, you will not believe.
In fact, the one that held, that kept me a whole night for more than 2 weeks. So standing, whenever I come, I have to. When the child, I have to say, hey, please wake up and start breathing. And when this child comes and you see her, you say, wow, God have done some.
Yes. So
That is the direct translation.
Yeah.
God has done some.
Yes. So these are the great testimonies that we have, that we are sharing, that
Yes.
preterm babies grow up to be great. They just need special care and attention, and let us give it to them.
Just to beat the referee so that the referee will not show the card. You know, with that early stage, if you're able to beat it and the child starts growing, you marvel.
Yes, very true.
Okay, we are yet to wrap up. In some few minutes, we will say bye bye. But before then, we are live from Adunfie, CCR Ghana Radio, and then as for us, we play only online. But you can still download it and play it at any given time. And in fact, with these important messages that I have received, I'm just downloading this video and I'm just going to keep it in case you are listening to me and you want to be my wife. Then I have to send you this video and you send to your mother too. So that in case, I'm not saying it should happen, but in case it happens, then we are not going to do any other logozigiting behind. Just to take care of these babies. Starting with my midwife, because they deal with the mothers a lot. How can we prevent this kind of cases, you know, with the preterm? I know some, they are preventable.
Yeah.
So how can we do to prevent them?
So we advise that a woman who finds out she's pregnant starts ANC or antenatal care as soon as possible.
Okay.
Antenatal care is a period where we are able to monitor and observe a pregnant woman to journey throughout the 9 months or less.
Okay.
So if you are not a regular attendant, if there is any rising of a maternal condition like the hypertension, the diabetes and all, you wouldn't be able to identify them in your home. So as we talked about the causes earlier on from the mother's side, if you are not a regular attendant, or if you don't take your antenatal care very serious, you wouldn't be able to identify all these factors very early. Infections can cause it. If you are being treated for any form of infection, make sure you are on the treatment regimen. Some people don't like medication. They take 3 days, they will stop. Then the infections become recurrent. So the more the infection stays in your body, the more you are also prone to delivering a preterm baby.
Okay. And doc, add up.
Okay, so even before you conceive, there's something we call preconception.
Doc, before you continue this,
The microphone.
in Ghana here,
So
we
that's
want
what
to,
we
we
are
want to, yes, we want to encourage people. Once
Okay.
you get married and you see that, okay, now you want to have a baby.
because
you have to
the
start-
reason why I'm saying it is that about 90% of pregnancies that comes, they come as a wedlock.
Unplanned.
Yes. So it will be difficult for us to, plan these things because coming this Xmas, and then you are going to experience
Yes,
a
we
lot.
are expecting them.
But anyway, just tell us, educate us. Maybe a few of us, maybe I may be part, may plan before we do that. So help us with that.
Okay, so we have something we call preconception care. So before you even conceive, you go and see your obstetrician or your gynecologist, and then
Okay.
you tell the person you want to conceive. So there are medications that they will tell you to start taking. They will screen you. So if you have any chronic illness like diabetes, hypertension, you make sure we control it before you conceive.
Okay.
So that during pregnancy you wouldn't have any issues. So sometimes we give you folic acid. If you need supplements, we give you supplements. We'll check your HB. If your blood level is low, we'll give you medications to boost your blood level even before you conceive.
Okay.
If you're able to do all these things, it will help us prevent preterm deliveries. Yeah.
And my boss think I'm coming to here, but I'm going to left. Oh, you have something to add?
Oh, okay, stress.
Uh-huh.
You see, someone is pregnant. There was this preterm mother that came. She said that night she came back from work. She decided to scrub her whole house, like stress. She's already tired. She's doing a lot. Or emotional stress. You are thinking this can cause preterm birth. So we should manage our stress when we are pregnant. And environmental exposures like the smoking, the drugs, and all those things, we should check it out when we are pregnant.
Okay, Auntie Midwife, I can see you have something to add, so add up and let's go.
Okay, so in as much as we are talking about all these things, we also want to advocate and encourage that fathers who are support birthing partners should also support women in through their pregnancy period.
House chores through
Any form,
And
finances, emotionally, physically, any form of support you should give to the mothers, because there are a lot of them that
But
whenever they come,
sometimes you need to give to the husbands too, because they go through a lot.
they go through a lot. But
Uh-huh.
pregnancy too is very delicate.
Okay, let's
So
continue.
you should give it to us there.
Uh,
So during this period, you have to be the second eye to the woman or your wife. There are
Okay.
some things that might escape her because of all this stress that she's going through. So if you're able to be the second eye to her, be observant, encourage her to do all these things, there are a lot of things that we can really prevent from happening throughout this period.
all right, and doc, you add up to the nutrition side.
Okay. So with the nutrition for pregnant women, you have to eat a balanced diet.
No more shiri.
Don't take shit.
Yeah, because I remember there was a story that I heard, though was a friend of mine. He said that there's a woman who like going to the roadside. You know, when you get to the village, the untarred road, people used to do their things around in the night. So sometimes because of the sun, it becomes hardened. He said that when she smells it, she feels good, and there is no food that she'll eat. So she like going to take some people's pim, and then and then we'll start smelling it. So I think we need to hammer this area. Very important.
Okay, so you have to eat a lot of that. You have to eat balanced diets.
Balanced diets. Should we add fruits?
Yes. It's part of the balanced diet. So more fruits, more vegetables, more proteins, less sugar, less fatty foods. That for proteins. right? So if you are eating more proteins, the baby will form well. The baby will form very well, have a good weight even before delivery and all that. So we should eat more proteins. Yeah. Then also we should avoid taking energy drinks. The mothers, energy drinks, alcohol, smoking, narcotic drugs, and all that.
Okay.
You should stop taking all those things. So basically, it's just eating your balanced diet. We don't have any special food for pregnant women. It's just a normal balanced diet we've been talking about. You have your protein, you have your fruit, you have your vegetables, you have your vitamins in it, you have less fat, you have less carbohydrates. Yeah, and then also sometimes there are some supplements that people take that contain folic acid and other nutrients like pregnant care and those things.
Okay.
Yeah, you can discuss with your obstetrician and then whatever he tells you to buy.
All right.
To buy it.
All right, that's very important. Do you have anything to, as we are wrapping up? Anything to add?
Okay, so it's just the encouragement of people. I mean, telling people to support preterm mothers or mothers who have or parents who have delivered a preterm baby. When you see them, encourage them. You don't have to say any discouraging words to them. That hey, obey dear. Now we do the ben obey kese. Now we dear. Like no, you have to encourage them. The least you can do is to even pray for them. Even if you can't say anything, just pray for them. If you have any money or you can support them financially, support them.
Nah. Auntie Midwife, your last words.
Okay, so prematurity is not asram. Prematurity is not insuba. Prematurity is not abnormality.
Okay.
They are just delicate and special babies who need special care and attention. Taking your medical advice very seriously, your baby can groom into a very beautiful, bouncing baby and then baby boy or baby girl. So there should be no stigma in any way or the other. We encourage that all families and society support any mother or any parent who goes through prematurity or preterm birth, and then we will all live in peace.
And our specialists?
So November is
please, my microphone.
November is the month that we celebrate prematurity.
Okay.
So in November you see health professional wearing purple and all that. It's just in solidarity with prematurity and preterm babies.
All right, so this month we are all going purple.
Yeah.
So when are you giving my purple shirt? Very soon.
Come for it.
Right after the show.
All right, we take it before we go. So today we are happy. We are happy that you come. Hey, is a brophy. We are happy that you came. So, my grammar teacher died. So we are happy that they came, and then we had a fruitful discussion, and we discussed prematurity, and then we been discussed about they help us discuss. We define it. We talk about the causes, the signs and symptoms. The signs that may show that someone is being born a premature. And if we talk about what we can do psychological, we talk about thermal regulations, we talk about infection prevention, and then psychological and then financial aspects, we added it. And then how we can also prevent this prematurity, we talk about that one too. And then we have practical examinations. Is it examination? Yeah, things, because some of the things that they talk about, they are very practical. And then we also encourage our mothers, our sisters, our aunties, our in-laws, that we should all come together to, take care of this baby. But one thing I like in Ghana is that Ghana is a society where every child is taken care by the community. And then we believe that kind of activity or that kind of kindness will be continuing. And we are not stopping it today. Special thanks to those who are listening to us. And then we say hallelujah, hallelujah, hallelujah. We say special thanks to you. May God bless you and all what you spent on us by listening to us. And we know that this thing is not just listening, but rather you are just taking time in order to help others to take care of the society so that we can have a fruitful future. Tomorrow, when we are young and we are old enough that we cannot do anything, or when we also give birth to a preterm baby, because we have a good heart of taking care of these babies, someone is also going to have the same good heart and take care of these babies for us. So in Ghana, what we said, not only in Ghana, but we say that what we think of others is what others also think for you. So it's very important. We are what we think and we are what we eat. So please, your last words and then we go. Who are you greeting? That is what I mean. Starting from Auntie Midwife. Auntie Midwife.
Okay. So special thanks to our pediatrician specialist, Dr. Adama Foko, for investing in us, yes, to have this opportunities to speak to the public about the knowledge that we've acquired. And then special thanks and then shout out to all NICU staff as well.
So you've just excluded Dr. Udial.
Dr. Yudia to his part. Dr. Yudia, Dr. Millicent, yes.
Okay. So, Doc, we are on you.
Yeah, so a special shout out to all
Please
the
get
staff.
close to the microphone for me.
Special shout out to all the staff of Hope Exchange Medical Center, doctors, janitors, people at the records, administration, and all that. Yeah. Special shout outs to them. Special shout outs to my parents, Mr. and Mrs. Samuako. And my siblings, yeah.
They go hear you rough. And our specialist?
Okay, I want to say a special greetings to my children, Makafi and Elikem, and my husband, Kingsley.
Into the microphone. Yes, speak into the microphone.
All right, to my children, Makafi and Elikem, and my husband, Kingsley. Say hello to them.
And then special thanks to those who also spend time and then they listen to us, our various listeners. In fact, you can also get the link on social media platforms, all the social media platforms, Facebook, TikTok, wherever you find it. You can go there and then you watch. Very, very important. This thing is, those students who are going to write examinations, you can also get your portion from this topic. And another special thanks to our producer, Mr. Andrews, for giving us this ample time. And with the machines, he was just pressing here, going here. The stress that he goes through in order to put us on this area for everyone to look at us and then watch us and listen to us is not an easy job. And special thanks to our Reverend Father Resford and Father Michael, our Fadun Fie, director and their assistants, Mr. Osei Francis, and everyone who made this area or this kind of studio possible for us to always get time to speak to our audience. And another special thanks to Matron Auntie Ines of Hope Exchange Medical Center, Dr. Adoma, and all the staff at the Pediatric Emergency Unit of Hope Exchange Medical Center, Child Health Department, and also at the Children's Ward before they beat me.